PAILS, P-A-I-L-S, stands for Progressive Angular Isometric Loading. These are isometric muscle contractions that strengthen the muscles placed on stretch. If your hip was flexed, think knees to chest, the progressive tissue would be the glutes and hamstrings. RAILS, R-A-I-L-S, stands for Regressive Angular Isometric Loading. These are isometric muscle contractions that strengthen the muscles on the closing side of the joint. So if your hip was flexed again, knees to chest, the regressive tissues would be your hip flexors and quads. PAILS and RAILS contractions are used whenever we see limitations in movement. Limitations in joint movement can happen from disuse, postural demands placed on the body, or injury, or niggles, or just continued training over a long period of time. To expand on this further, they help to teach the body that your end range motion is safe by driving a limb into an object and creating a strong muscular contraction. Your nervous system realizes that position is actually safe to be in. This then allows your rails contraction to allow you to pull yourself into a deeper stretch, thus starting to expand your ranges. The muscle contractions on both sides of the joint help strengthen the end ranges, allowing them to become acquired actively over time. So if we're working the 90-90 hip internal rotation for PAILS and RAILS, firstly, using the ball just helps us to dissociate the rib cage and hip better. By when we hold the ball, we're trying to stay taller through the rib cage, taller through the thoracic spine, and getting some more extension there. And without the ball, people tend to like slouch over into the movement, and it kind of defeats the object a little bit. So if we can use a external object to reinforce this better spinal position, it makes this movement better. So in order to perform the PAILS and RAILS, statically first hold a 90-90 hip position for, let's aim for 30 seconds each side. And when you swap sides, you can just slowly move through that 90-90 rotation and just find a good position for you to move across each side with your hips moving quite smoothly. Try to keep the ankles on the floor. Obviously, it might feel tight at first, but just keep working the rotations and things should loosen up. Once you've completed the static hold on each side for either 1 minute or 30 seconds, perform a PAIL contraction with your leg or the knee driving down into the ground and then turning away from that contraction. Yeah, trying to ramp up the tension to about 80% effort. Yeah, and then count for 10 seconds. Afterwards, after the PAIL contraction, reverse into the RAIL contraction by aiming to lift the ankle up towards the shoulder, keeping the knee on the floor. Now you can turn into that contraction. So if you're trying to lift the ankle and drive the knee down, turn towards the shoulder and in towards the ankle. Yeah. Again, ramping tension effort up to about 80% effort with a 10-second count. Do this 2 to 3 times for 10 seconds. And afterwards, you can again go through the 90-90 rotations just to feel out the improved mobility in your hips.